Hello, Dr. Ryan.
Good morning, Mark.
There you are. Gee, every week it's some technical surprise for me here. All right, enough of that. Welcome back to the show, and let's get right down to it. I know you just did this, but if you could review for the folks the status of our vaccinations and positivity rates and all that current information for Clear Creek County. Let's get through that.
Okay, sounds good. So vaccinations, we're rolling through as we receive vaccines. Unfortunately, we're not receiving as many as we'd like. Currently, we're receiving about 100 a week, or every other week at this point seems to be our cadence with the state. We have, though, been successful in vaccinating our most at risk in the 70-plus folks and the frontline responders. So we vaccinated 70-plus% of the 70-year-olds, 70-plus-year-olds in our county, which is great news. And we'll continue to take away at that as we receive more and more vaccines. Our incident rate in this county, as well as across the state, continues to decline. As you know, we reinstated testing, the community-wide testing last week. Last Tuesday was our first week in several weeks. Happy to have that back online, and testing is resuming again today, and will continue through March every Tuesday. That's taking place in Idaho Springs. If you visit our website, Clear Creek County Health website, you can find a link there to pre-register for the testing site. And then just show up. You can also just show up. They're doing registrations right on this site. So the company will be changing next week to COVID Check Colorado, but you will not notice any difference in the testing. Same format. You show up, you get tested, you'll get your results in a couple of days. This new company is far better in terms of turnaround time than we previously experienced with Curative. So that's good news for us. And good news for folks out there who are getting tested. You'll get your results back in a couple of days as opposed to 5 or 6. So good on that front. This week we are going to begin vaccinating some of our teachers because of our limited number of supply. We're not able to vaccinate all of them at once. So we're doing it in phases, if you will, and vaccinating the older teachers first and then moving on down the line there. So, but continuing at the same time to vaccinate the 70-plus folks who remain, and then we'll drop down below that 70-plus mark once we've vaccinated all of them.
Okay, I would like to put a pin in that in the school conversation. I've got some questions later on, but I think everyone's encouraged by the trend in caseload nationwide and across our community as well. And also the trend up in the number of vaccinations nationwide, although it's kind of frustrating to hear that we're not getting any more vaccines here in the county, even though there has been vaccines distributed nationwide. Nevertheless, what do you think is are the predictable trends for the vaccinations and for the caseload going forward? I know you don't have a crystal ball, but you must have some sense of that.
No, I use my magic 8-ball. I ask that serious questions every day and get good quality answers. But in all seriousness, I'm very optimistic in terms of case counts going down. The wild card in that whole equation, obviously, is the variants that everyone has heard of. There are 3 circulating pretty widely here in the U.S., the UK variant, the one from Brazil, and one from South Africa. Those are the most worrying because a prior COVID diagnosis does not necessarily protect you from getting COVID again via one of those variants. And given the increase in transmissibility among those variants and the significant spread that we've seen already in the U.S., even in the limited time, is most worrisome. We do know, however, the vaccine is effective against those 3 variants, not necessarily as effective as they would be otherwise, but still effective in providing protection. So it's unfortunately going to provide create the need for us to continue doing what we've been doing for many months now, social distancing and wearing masks and avoiding large crowds. It's just unnecessary. And until we have enough folks who are vaccinated in this country, that's going to be our reality, at least for the next several months. So hopefully we're going to see a ramp up in production in the vaccines. I know the Biden administration has been working tirelessly for the last 3 weeks to try to get that happen. Colorado is receiving an increase as of this week, I think, of an additional 17,000, which, if you spread it across the state, not really that much, but it can have an impact on any one community or county at a time, and hopefully that number will dramatically increase in the coming weeks. I also know the Johnson & Johnson vaccine, they have applied for their emergency use authorization, and their FDA will be meeting on the 26th, I believe. It may be 27th, I'm not sure exactly, but around that time to discuss the vaccine clinical trial data and then give it approval or not. And if the Pfizer and Moderna vaccine are any indication, it seems like the next day that post-approval, the vaccines will start to be shipped. So that's another potential game changer that we could anticipate perhaps in the first week of March, not only here in Colorado, but across the country. And logistically, between the vaccines, the Johnson & Johnson is far simpler. It's a single dose. It's one and done. And so the efficacy is still quite high, 85% keeping you out of the hospital and are dying, which is fantastic. And I think the logistical challenge is a good trade-off for the slight reduction in efficacy. And so I think it's going to be a game changer for the general population once we get out of the sort of these nuanced pockets of age groupings and or employment groupings, and we get to the general population. That Johnson & Johnson vaccine will be a huge plus.
Yeah, it seems as though we're kind of stuck in this production cycle, which isn't really supplying the type of vaccine doses that we need to get anywhere near what's commonly referred to as herd immunity. And I'd like to take a little bit of a deeper dive into that phrase, herd immunity. Explain to everyone what that actually means. Can you do that for us, Doc?
Oh, absolutely. So the concept behind herd immunity, in most cases, in this case, it's slightly different because there is no historical immunity to something, right? So herd immunity is where you have a community. Let's take America, for example, and any number of people in the community, more broadly, have a historical exposure to a particular virus. So that offers them some level of protection. And then when you throw on top of that a vaccine for said virus, it adds even further protection. So there's a segment of our population in America that actually can't get the vaccine for a whole host of reasons. And it's not personal preference. It's for actual medical reasons. And so it's incumbent upon everyone else to get vaccinated to help protect those folks who can't actually receive the vaccine. So the concept of herd immunity is where enough individuals either have a historical protection and or a vaccination to protect against the virus. And that typically is in the 70, 80, it really depends on the specific disease, but in the 70, 80% range, sometimes higher, of people who either have a historical immunity to it and or a vaccine that they've received to help them protect it. It will then subsequently help protect the remainder of the population, the 10, 20, 30% who can't get the vaccine or don't choose to get the vaccine. And the way viruses work, if enough of the population is vaccinated or has a historical protection, antibody protection against it, the virus sort of meets a lot of dead ends, right? It gets to one person and that person has immunity, and so that person ends up killing the virus and it doesn't transmit it. And so if enough of those people have that protection, the virus will go away quite quickly because it doesn't have enough hosts or people who are susceptible to the virus. And so that's basically how we get to that point. If enough people have historical immunity, which we do have some, although the variants are troubling in that perspective, but the other route is vaccines. And so the sooner we can get people vaccinated, the better, and the quicker we'll get and reach to that point of herd immunity.
Okay, now that clears up, I think, a lot of questions people might have, but it brings up some other questions. We talk about herd immunity in this sort of absolute term, but if the variants, the new variants that have been discovered in the last month or 6 weeks, if they've taught us anything, that's a herd immunity can be a relative term, and that there may be some partial immunity, but not full immunity based on these variants. Am I right on that? I think I've got that.
Correct. It's similar to your typical flu, right? In any given year, the flu changes year to year, and this is why we get vaccinated every year for the flu. The flu vaccine itself isn't 100% effective, not even close. It's typically around 50% effective. But what you also have is that historical immunity out in the community, that if they're infected with the flu, it's going to be very mild or moderate because they have historical protection. Similarly here with the variants, individuals who've had a previous COVID exposure or diagnoses, I should say, have some level of protection against the variants, but it isn't quite to the level where the vaccine would be. So the vaccine will offer you, in the case of the Moderna and Pfizer vaccine, a much broader level of protection against these variants than having prior exposure to or prior diagnosis of COVID. It would offer you, and this is all new, as you pointed out, it's 4 to 6 weeks or so of collecting data and still trying to parse out the nuances in it. And so we're still learning about how much and what level of protection does the vaccine still offer, and what level of protection does prior COVID diagnosis offer in protection against these new variants. So we're going to be learning more here in the coming weeks, and hopefully we can get people vaccinated quick enough, and that people will continue to abide by the social distancing and mask wearing and don't go to large gatherings. And that will help reduce the transmissibility or the transmission of those variants in addition.
Yeah, I've read that the British variant is about, 50% or so more transmissible than the original COVID vaccine or virus. And that the South African variant has reduced efficacy of the vaccines that are available to us right now. But that's information that, as you say, is being gathered. One of the things that is a question in my mind that I think is critical to the outcome here is I know that when you're vaccinated, that you have some personal protection, be it whatever the percentage is. You're going to have some personal protection. So you can't become sick or die, but that doesn't preclude the virus from getting into your nasal passages, and maybe you pass it on to someone else. So, in other words, just because you're vaccinated and protected against becoming ill doesn't mean you're protected against transmitting the virus to someone else. Am I wrong on that?
No, that's absolutely correct. The vaccination and the process of vaccination for anything, it offers you as an individual protection, and subsequently through herd immunity, others eventually protection. But the challenge is still there. You still, as a vaccinated individual, can get COVID in this case. You can become ill, although it might be you don't notice it because it's so mild. You don't really notice it, but you can also pass it on, to your point. And unfortunately, when you are vaccinated, it gives some people a false sense of security that, I don't have to wear a mask or I don't have to social distance. None of those things are true. You still have to do those things because it isn't about you. It's about everyone around you and what the potential is for them, because in a lot of cases, everyone around you hasn't been vaccinated. If they're not an older folk, older than 70, or they're not a frontline worker, the likelihood of them being vaccinated is quite low at this point. So it's incumbent upon those who have been vaccinated to continue to do what we've been doing and help until everyone gets vaccinated to a level that we can then remove our masks and go back to life. But we're not quite there yet. We got many months ahead and many millions of people to vaccinate in this country before that becomes reality.
Yeah, especially in light of the rapid spread of the British variant. I guess I've read that it will become the predominant variation of the COVID by March, and so even if you've been vaccinated, if it's so easily transmissible, then that increases the likelihood you could pass it on to someone else. So we've got to keep wearing our masks. It also occurs to me that there are a number of people in our community who are 70 years old and have been vaccinated, but who live with someone who is not 70 years old. And if they go out and start living their lives as though they're bulletproof, then they could easily bring the COVID home to their loved ones.
Exactly. Yeah, you're spot on, Mark.
Okay, I wanted to talk a little bit about testing again. Last week we talked about the testing in Clear Creek County had been delayed for a while, but then it started up again last Tuesday, I believe, and I think I remember it was 19 people had been tested last week. How many have been tested, are scheduled to be tested this week? Do you know?
I don't. We don't have access to that data in terms of who's registered. We only find out after the fact at this point. It's being run completely by the company. In this case, it's Mako Medical. They're the ones running the show, and so after the fact, we will learn obviously a positive, and then get a sum total of those who were tested. So I don't know that number. It's ongoing right now. It's 10 to 2. It's a schedule every Tuesday in Idaho Springs. And so, in addition, other people are getting tested elsewhere, right? Lots of people go outside the county to go to Jefferson County or other counties to get tested. And so, again, in that scenario, we don't learn about that until after the results come back.
Yeah, can you just briefly describe to folks why it's still important to be tested, even though they may have been sick with the COVID some time ago, or they just are tired of the whole regime and want it to go away? Why is it still important to be tested?
It's important because of what we've been talking about for the last half an hour in the prevalence of these variants. Even if you had COVID 3 months ago, there is still the potential that you could be reinfected with one of these variants and have a similar outcome to what you had the first time, or potentially worse. So it's still very important to get tested, and the number hasn't changed in terms of asymptomatic individuals. We still know that roughly 50% who are COVID positive, variant or otherwise, who are actually asymptomatic. So it's important to get tested regularly. It's also important why we're going to continue doing the testing in the jail of staff and inmates, as well as in the schools of the staff and teachers that are there. Even post-vaccine, once all the teachers have been vaccinated, we're going to continue to test because in this case, knowledge is, the test data that we have is power to us. It tells us and gives us insight into what's out in the community. And that's an absolutely critical piece of information that we need. We can't just rely on the people who want to go to the test site in any given week. We're trying to get a surveillance sampling out there, both in this case, the jail and in the schools, to really keep our fingers on the pulse of the community and understand the prevalence that's in our community.
I heard you mention that some of the teachers are going to be vaccinated, some of the older teachers first. I applaud that effort. It made me think of the schools and what they're doing to mitigate the potential for transmission of the disease within the school environment. I know that the CDC has said that if certain mitigation measures are put in place, that it can actually be safer to be in school than to be at home. And so I wonder if that's true for our community or if that's some more urbanized communities. And I wonder what efforts we have been taking to mitigate as best as we can the transmission of COVID.
Mark, a great question. I'm glad you brought that up. I cannot say enough about the superintendent of the school district, Karen Quambeck, and the principals of the school and the teachers. They've been doing an absolutely fantastic job at following guidance and putting in place protocols to keep not only the teachers safe, but the students as well. The fact that we've been open this entire semester for in-person learning without a single case in or from the school. In addition to last semester, we did spend a little bit of time at home, but trying to minimize that as much as possible. And our goal is to keep the kids in school for the rest of the semester. They may do a buffer week after spring break, just to be out of an abundance of caution, which is one of the protocol they put in place this last semester, right? The week after Christmas break, they had a week buffer, same with after Thanksgiving, a week buffer at home, just to make sure they're not bringing anything back into the schools. But they have a very strong mask mandate there. The students are required to eat with the same group of kids that they eat lunch with every single day. They're not really allowed to change that up, primarily because if there is an outbreak, we can limit the exposure to any one student. And lunchtime is the primary opportunity for spread, right? Kids are not wearing their masks. They're eating lunch, although they are socially distanced, table to table and around the cafeteria. Those protocols in place have helped minimize the potential for spread. Hand washing, another thing, temperature checking. They're doing all these sorts of things, not only among the students, but among the faculty at the school. So, and all of those have had a significant impact on reducing the potential and hoping to keep these kids in school. That's where they belong, and that's where they will do their best learning. And it also gives, more importantly, it gives parents a break and allows them the opportunity to go to work and to know that their kids are safe and taken care of at the schools and learning and not sitting at home struggling. It's particularly important for kids who don't have internet access or a strong background or strong ability with the online learning. For some kids, it's a real struggle. So getting them back in school and it also increases the socialization, right? These kids, they're of the age that they need to be socializing in a safe way, but it's very important for their mental health and for their general well-being.
Well, it's gratifying to hear that the close collaboration that you've had with the school district and their intense focus on the safety of the students and staff at the schools. I'm also interested in, you mentioned the jail, and I think a lot of people, just their initial knee-jerk reaction would be, who cares? But that is a focal point of spread of COVID throughout the country, and it could be here in Clear Creek County as well. So I heard you say that you've been monitoring that. What gives there?
Yeah, to your point, it's a primary place of spread, a primary place of outbreak across the entire state. Here in Clear Creek, we've managed to avoid that completely. I think that's through the efforts of testing. Who cares? I care. I care about every single individual, whether they're incarcerated or not, in the county. They're my responsibility. So doing surveillance and doing testing in that community is absolutely critical because it goes well beyond the inmates, right? There's many staff who work there, sheriff, deputies, et cetera, and those folks go home. They go out into the community. So understanding what's going on within the jail is absolutely critical and very important information. So there's a nurse or several nurses who are working at the jail. They also work at the school there in Georgetown, and they're the ones who have been doing the testing on a weekly basis. That will be reinstated next week. We had through the gap in testing, but we're going to reinstate that next week, like I said, both in the jail and in the schools. It's our way to have our finger on the pulse of what's going on out in the broader community beyond the community testing that's available to the free walking folk who can go in and get tested on their own free will. But it's an absolutely critical population to keep our eye on.
Well, I certainly couldn't agree with you any more than that. I would say right up front to the folks who have said that to me, who cares what happens to them? They broke the law. Well, we have a responsibility as they're in the community's custody. We have a responsibility to those people on a moral level, and then as a practical measure, as you said, there's people interacting with that population that is in close quarters all day, every day, and you know that's a place where it's been shown to spread COVID throughout the communities across the country. So I'm glad to hear you say that you're on top of that and that we haven't had any cases coming out of there either. I give a shout out to the sheriff and to the judicial authorities in Clear Creek County as they've recognized that releasing some people who are nonviolent offenders and could easily be monitored from within the community was a practical thing to do, and they went ahead and did that. So shout out to those folks too. Dr. Ryan, I wanted to finish up with one last thing. This week is the monthly town hall a meeting that's on Thursday evening. Why don't you tell everybody what that's about and how they can join in?
Absolutely, yeah. So we've been having a virtual town hall once a month. It will be this Thursday from 6 to 7 p.m. You can join either via the Facebook link and or the Zoom link that's available on our website, Clear Creek County Public Health website. There's a virtual link there. You have to pre-register. The point of that is so that we know if, and our numbers have been growing. So we on any given call, we have several hundred people who are on the call. So we just want to know that we can manage the capacity that we have. And so we ask people to pre-register, at which point you'll be sent the link. And then you just click on that on Thursday night. It's an opportunity. So I do generally a brief presentation on sort of the numbers and where we're at, the state of the state, if you will. And then we spend the bulk of the time answering questions. And any question you have, please come and ask that question, and we'll get you the answer as best we can. And so it's an opportunity for the community to not only hear and also ask questions and hear what other questions are asked as well, because, you might not be the only one with that question. There's probably others out there. And so it's a great opportunity to have that chance to ask. And it's not only myself, but my staff is on the call. And as you are aware, half of my staff right now is doing very untraditional public health things, like, for instance, writing grants and disseminating tens of thousands and hundreds of thousands of dollars out to the business community. So half my staff on any given day is really spending their time about looking at economic development and economic sort of parity, if you will, in disseminating those funds that the county has received, and both writing grants to receive additional funds that are going directly to businesses. So we've spent a lot of time as the public health around economic development, strangely enough, over the last 7 months or so, and we'll continue to do so, trying to help our business community as best as we possibly can. Even though it's really not the wheelhouse of public health, but we've taken that task on, and we have an absolutely fantastic team who's working with the business community every single day.
Well, I just want to encourage people to think of their own self-interest here. We're talking about your health and your money in the community, as opposed to, let's see, watching The Sopranos again. Let's get on that Zoom town hall and all participate. Ask the questions that need to be asked so that we have the information going forward that we need. Dr. Ryan, thank you so much for joining us again today. You're always a revelation when you come on the show, and we appreciate you helping the community understand this difficult time. Well, it looks like there's a little light at the end of the tunnel, but not yet, right?
We're getting there, Mark. Little by little, we're getting there. I am optimistic and hopeful that this summer will be unlike last summer. And so we're just going to take everyone. It's going to take your patience, both in terms of getting a vaccine. We will vaccinate you as soon as we receive the vaccine, and we'll disseminate that as quick as possible, hoping to get more in the future. But we will vaccinate everyone who wants a vaccine in the county. In addition to be patient and continue to wear your mask and continue to social distance. Clear Creek has been knocking it out of the park as far as that's concerned. Compliance is quite high, and it's what's kept our numbers down. If you look at a lot of the counties around us, we're doing one of the best jobs of anyone around us, big or small. And so I think we need to keep that up. And, I'll get people vaccinated as quick as we can, but we need to keep doing those sorts of things to help keep that variant out of here. The variant right now is the biggest threat to us. And so doing the things that we've been doing for months and continuing to do those things will be a huge help.
Well, I'm assured that you and your staff will be doing your part, and it's up to us to do our part as well. Dr. Ryan, thank you so much for your time today, and we'll talk to you again soon.
Always a pleasure, Mark. Thank you, sir.
Goodbye now. All right. Always great to talk to Dr. Ryan and get the latest information. And the latest includes something that we've heard since the beginning. Wear a mask, stay away from social gatherings, wash your hands, and protect yourself and your loved ones as best as you can so we can get through this thing together. Thank you so much for joining us today, and we'll be back again next week.